Home remedy for athlete's foot. What is athlete's foot? Athlete's foot, also called Tinea Pedis, is a contagious fungal infection that affects the skin on the feet. It can also spread to the toenails and the hands. The fungal infection is called athlete's foot because it's commonly seen in athletes. Athlete's foot isn't serious, but sometimes it's hard to cure. If you have diabetes or a weakened immune system and suspect you have athlete's foot, you should call your doctor right away. Pictures of athlete's foot. What causes athlete's foot? Athlete's foot occurs when the tinea fungus grows on the feet. You can catch the fungus through direct contact with an infected person, or by touching surfaces contaminated with the fungus. The fungus thrives in warm, moist environments. It's commonly found in showers, on locker room floors, and around swimming pools. Who is at risk for athlete's foot? Anyone can get athlete's foot, but certain behaviors increase your risk. Factors that increase your risk of getting athlete's foot include visiting public places barefoot, especially locker rooms, showers, and swimming pools, sharing socks, shoes, or towels with an infected person, wearing tight, closed-toe shoes, keeping your feet wet for long periods of time, having sweaty feet, having a minor skin or nail injury on your foot. What are the symptoms of athlete's foot? There are many possible symptoms of athlete's foot, which include itching, stinging, and burning between your toes or on soles of your feet, blisters on your feet that itch, cracking and peeling skin on your feet, most commonly between your toes and on your soles, dry skin on your soles or sides of your feet, raw skin on your feet, discolored, thick, and crumbly toenails, toenails that pull away from the nail bed. How is athlete's foot diagnosed? A doctor may diagnose athlete's foot by the symptoms. Or, a doctor may order a skin test if they aren't sure a fungal infection is causing your symptoms. A skin lesion potassium hydroxide exam is the most common test for athlete's foot. A doctor scrapes off a small area of infected skin and places it in potassium hydroxide. The CO destroys normal cells and leaves the fungal cells untouched, so they are easy to see under a microscope. How is athlete's foot treated? Athlete's foot can often be treated with over-the-counter (OTC) topical antifungal medications. If OTC medications don't treat your infection, your doctor may prescribe topical or oral prescription-strength antifungal medications. Your doctor may also recommend home treatments to help clear up the infection. OTC medications. There are many OTC topical antifungal medications, including meconazole, Desenex, terbinafine, Lamisil, clotrimazole, Lotrimin AF, butenafine, Lotrimin Ultra, tolnaftate, Tinactin. Find these OTC antifungal medications on Amazon. Prescription medications. Some of the prescription medications your doctor may prescribe for athlete's foot include topical, prescription-strength clotrimazole or meconazole, oral antifungal medications such as intraconazole, Spirinox, fluconazole, diflucan, or prescription-strength terbinafine, Lamisil. Topical steroid medications to reduce painful inflammation, oral antibiotics if bacterial infections develop due to raw skin and blisters. Home care. Your doctor may recommend that you soak your feet in salt water or diluted vinegar to help dry up blisters. Alternative therapy. Tea tree oil has been used as an alternative therapy for treating athlete's foot with some success. A study from 2002 reported that a 50% solution of tea tree oil effectively treated athlete's foot in 64% of trial participants. Ask your doctor if a tea tree oil solution can help your athlete's foot. Tea tree oil can cause contact dermatitis in some people. Find therapeutic grade tea tree oil on Amazon. Complications. Athlete's foot can lead to complications in some cases. Mild complications include an allergic reaction to the fungus, which can lead to blistering on the feet or hands. It's also possible for the fungal infection to return after treatment. There can be more severe complications if a secondary bacterial infection develops. In this case, your foot might be swollen, painful, and hot. Pus, drainage, and fever are additional signs of a bacterial infection. It's also possible for the bacterial infection to spread to the lymph system. A skin infection could lead to infections of your lymphatic system or lymph nodes. Long-term outlook. Athlete's foot infections can be mild or severe. Some clear up quickly, and others last a long time. Athlete's foot infections generally respond well to antifungal treatment. However, sometimes fungal infections are difficult to eliminate. Long-term treatment with antifungal medications may be necessary to keep athlete's foot infections from returning.